Good morning, dear ladies and gentlemen. Good morning, Canada. My name is Taskyn Koshman. I'm the Regional Director of CERBA-Kazakhstan, and I'm Coordinator for Kazakhstan-Canada Business Council. I'm pleased to welcome you to the KCBC Health and Education Working Group as part of the 4th KCBC meeting devoted to post-pandemic development of Kazakhstan and Canada cooperation. In 2013, former CERBA National Chairman, Mr. Nathan Hunt, current chairman of CERBA Russia, and myself initiated the creation of Kazakhstan-Canada Business Council and received a great support from both governments of Kazakhstan and Canada and businesses. The CEO of Kazatomprom and President and CEO of Cameco Corporation agreed to become co-chairs of the Business Council, and in 2016, we held the first inaugural meeting of the Council. CERBA, with its 9 offices in Canada and Eurasia, the mission which is to promote trade and business, and the Chamber of International Commerce of Kazakhstan agreed to become a co-organizers of the Council, and was identified the main goal of the KCBC is promote cooperation, trade and investment between companies and organizations of Kazakhstan and Canada. During this period, we organized and held numerous meetings and events in the margin of created working groups in different industries. The Healthcare and Education Working Group is meeting for the first time since the inauguration of KCBC, and we hope to establish great, long-lasting cooperation in these fields. I wish everyone today a fruitful time and would like to invite my colleague Vera for a few technical updates. Please, Vera.
Yeah, dear colleagues, good morning, good afternoon to everyone. Thank you very much for joining for the event today. So the technical support comments would be really short. So please know that all your videos and audios would be switched off. If you have any questions, please don't hesitate to submit them to the Q&A session, to the Q&A box you can see on your screens. This event will be recorded. The video would be available, as well as all the presentations would be also available after the event, so we will mail them out. If you have any questions, any requests, please reach out to Taskyn Koshman, so she'll be able to help you, as well as you can also find all the CERBA regional directors' contacts on our website. Otherwise, that's it for now. Please enjoy the event, and thank you once again for joining.
Thank you, Vera. Dear ladies and gentlemen, I'm very honored to inform you that today's working group chaired by Margaret Skok, former ambassador of Canada to the Republic of Kazakhstan, the Kyrgyz Republic, and the Republic of Tajikistan, senior fellow at Carleton University, and Mr. Yerlan Kiyasov, Vice Minister of Healthcare of the Republic of Kazakhstan. Just a few words about Margaret Skok. As a career federal public servant, has focused her work on domestic and international business development, trade policy, and security. Amongst her assignments, she served with Global Affairs Canada at the Embassy of Canada in Moscow 1991 and 1994, and as an ambassador of Republic of Kazakhstan with concurrent accreditation to the Kyrgyz Republic and the Republic of Tajikistan. Ms. Skok has received the Deputy Minister's Award for exceptional and distinguished accreditation to the to the Canadian Public Service, and a Senate Award for Women in International Business, and is a member of several organizations, including the Canada, Eurasia, Russia Business Association. Margaret, floor is yours.
Thank you. Excellencies, distinguished speakers, guests, Monsieur, Madame, Hamindar, Mirsalar. At the outset, I think it's really important to thank the co-chairman of KCBC, the president of Chemical Corporation, Mr. Tim Gitzel, and the chairman of the board of Kazatomprom, Mr. Galim Pirmatov. Together, they've actually facilitated our bilateral networking and potential partnerships. I also need to thank His Excellency Ambassador Kamaldinov and the various ministries in Kazakhstan, as well as our colleagues in Global Affairs and at the Embassy of Canada in Nur-Sultan for making this year's event possible. And of course, Monsieur Gilles Breton, CERBA's chairman, who helped marshal us through this important initiative with a very talented CERBA team. As Taskyn referred, I would note that there are 5 working groups: construction and infrastructure, agriculture, agritech, aerospace and transportation, energy and natural resources, and finally healthcare and education. When we struggled earlier in the year as to whether or not we established this working group, we did not know or anticipate that we would get such a strong support from both the presenters and participants. And Vera, if you want to correct me, there are approximately 135 people listening, which indicates serious interest. What is equally important is that during a time when educators, practitioners, technologists, researchers, analysts, policymakers are grappling with domestic and international challenges, that you all have made the time for today. There is no aspect of our economy and society that has not been touched by COVID. On the Canadian side, for 8 months now, our Prime Minister, premiers of provincial and territorial governments and their medical officers have almost daily briefings and are working together. This in spite the usual political differences. We have 2 programs today, as you have seen, healthcare and education. These are challenging sectors, however, each with opportunities for cooperation and collaboration. In both groups, the presenters are experts in their fields. Vera, can I get that slide on the epidemiological data, please? Is that possible? But I mean, you won't be able to see it, but if you need to see it every day, Canada updates. It's unfortunate that the numbers are going up. This is a slide that reflects the current cases November 17th. Today, right now, until I get an update, there are over 330,000. As you know, our border to the United States, except for essential travel, is closed now until December 21st. And as of yesterday, and we will know more this afternoon, several provinces and territories are speaking about partial lockdowns, full lockdowns, and possibly interprovincial travel restrictions. At this time, I do want to introduce my co-chair from Kazakhstan for the healthcare portion of the program, Vice Minister Yerlan Kiyasov. He has had 30 years of work experience in the healthcare system, from medical orderly to vice minister. And today, during the COVID pandemic, he's also leading the important issues of protecting public health as the chief state sanitary doctor of the Republic. Sir, the floor is yours.
Добрый вечер.
Добрый вечер.
Доброе утро в Канаде.
Доброе утро, добрый вечер.
Уважаемая госпожа Маргарет Скок, уважаемые участники заседания рабочей группы, от имени Министерства здравоохранения Республики Казахстан, позвольте поприветствовать вас на первом заседании рабочей группы в области здравоохранения и образования в рамках работы Делового совета Казахстан-Канада. Сотрудничество между Казахстаном и Канадой в сфере здравоохранения, на наш взгляд, имеет огромный потенциал. Система здравоохранения Канады является одной из самых эффективных в мире. Продолжительность жизни составляет один из самых высоких показателей среди развитых стран. К тому же канадское здравоохранение в подавляющем большинстве случаев финансируется государством и обеспечивает всеобщий доступ к государственным медицинским услугам вне зависимости от места проживания населения в стране. Однако события 2020 года показали всему миру, что никто из нас не был на 100% готов преодолеть вызовы глобальной пандемии. Эпидемия коронавируса продемонстрировала ключевое значение международного сотрудничества, взаимодействия и поддержки в борьбе с инфекцией. В этой связи необходимо считать проведение данной встречи значительным вкладом для обмена опытом, а также активизации сотрудничества между Казахстаном и Канадой. Сегодня в повестке дня заседания рабочей группы рассматриваются такие актуальные вопросы, конференции, как обмен опытом борьбы с COVID-19 в Казахстане, продвижение инвестиционной политики, а также развитие медицинского образования и повышение кадрового потенциала в области здравоохранения.
Thank you very much, Vice Minister. Before we start first session, I would like to take this opportunity and express our greatest gratitude to the KCBC fourth meeting sponsors, the National Atomic Company Kazatomprom and Canada Corporation, Cameco Corporation, and the both governments of Republic of Kazakhstan and Canada for the great support in organizing the series of KCBC events, and to my CERBA colleagues for their enormous input. And I would like to ask distinguished speakers to be very precise with presentations and keep in mind timing, since we have more than we were expecting and planning to have speakers, and be please care with time. And now let me open the first session, healthcare session, and I would like to invite Mr. Danay Smagulov, Director of the Investment Policy Department of the Ministry of Health of the Republic of Kazakhstan, Public-Private Partnership Projects in the Healthcare Sector of Kazakhstan. This will be the topic of Mr. Smagulov's presentation. Mr. Smagulov, floor is yours.
Спасибо, уважаемые участники совещания. Министерство здравоохранения Республики Казахстан отмечает важность развития сотрудничества в области здравоохранения между Канадой и Республикой Казахстан. Стоит уделить внимание вопросу партнерства в рамках обмена опытом по строительству медицинских учреждений в рамках государственно-частного партнерства. В настоящее время в Республике Казахстан планируется масштабное строительство 20 крупных многопрофильных больниц по международным стандартам с привлечением иностранных инвесторов через механизм государственно-частного партнерства, что поможет обновить коечный фонд страны на 50%. По 15 проектам на сегодняшний день имеются потенциальные частные партнеры с международными финансовыми организациями, такими как Европейский банк реконструкции и развития, Азиатский банк реконструкции, Евразийский банк реконструкции, международная финансовая компания IFC, проработаны источники заимствования. Данные проекты будут реализованы по схеме частной финансовой инициативы. Потенциальным инвесторам может быть предложено участие в следующих проектах. По 4 проектам планируется проведение двухэтапных конкурсных процедур. Первый в городе Алматы, общая мощность 300 коек. Концессионный проект строительства университетской многопрофильной больницы. Объявление конкурса планируется в первом квартале 2021 года. С целью привлечения потенциальных международных инвесторов в рамках данного проекта Министерством здравоохранения совместно с Европейским банком реконструкции и развития предусмотрено проведение роуд-шоу 11 декабря этого года. Второй, в городе Караганде, общая мощность 300 коек. Концессионный проект строительства университетской многопрофильной больницы. Объявление конкурса планируется в третьем квартале 2021 года. Далее, в Усть-Каменогорске, общая мощность 330 коек. Планируется реализовать данный проект совместно с Азиатским банком развития. В случае подписания соглашения на консультативное сопровождение проекта объявление конкурса планируется в третьем квартале 2022 года. Также по городу Усть-Каменогорск 300 коек. Проект реализуется акиматом Восточно-Казахстанской области. Объявление конкурса планируется в первом квартале следующего года. По одному проекту в городе Кызылорда, общая мощность 500 коек, планируется привлечение займа Европейского банка реконструкции и развития под государственную гарантию. На строительство будет проводиться двухэтапный конкурс по правилам Европейского банка реконструкции и развития по привлечению подрядной организации. Сроки реализации проектов от 5 до 30 лет. Для реализации данных проектов со стороны государства могут и будут предоставлены следующие меры поддержки. Первое – это выделение земельного участка. Второе – подведение инфраструктуры. Третье – возмещение капитальных затрат, возмещение операционных затрат и вознаграждение за управление. Окончательная сумма выплат со стороны государства будет определяться по итогам конкурса и экономической экспертизы конкурсных заявок. Учитывая значимость проектов для сферы здравоохранения и острую потребность в качественной медицинской помощи населению, реализация данных проектов находится на строгом контроле у главы государства. Спасибо за внимание.
Thank you very much, Mr. Smagulov. Now I would like to invite Mr. Talgat Tursynbayev, Vice President of the Public-Private Partnership Center in Kazakhstan. Talgat Tursynbayev, Vice President of the Public-Private Partnership Center, responsible for the state of PPP in general, including policy, methodology, and as well as assessment of the implementation of PPP projects, with issues of state financial obligations under the PPP contracts.
Добрый день.
Yes, please.
Добрый день, уважаемые коллеги. Доброе утро для канадской стороны. Меня зовут Талгат Турсynbayev. Я являюсь вице-президентом Казахстанского центра ГЧП. Это юридическое лицо, определенное правительством Республики Казахстан именно по развитию вопросов ГЧП. Институт ГЧП в Казахстане существует более 15 лет с момента принятия закона о концессиях. Можно следующий слайд? И на сегодня мы имеем 815 проектов, это данные на 1 ноября, 815 проектов государственного частного партнерства на территории Казахстана. Общая сумма проектов составляет около 2 триллионов тенге, из них это 545 частных партнеров, то есть инвесторов, и вложено около 1 триллиона тенге инвестиций. При этом нужно отметить факт, самый интересный, что 30% из 815 проектов ГЧП реализованы в сфере здравоохранения. В целом из инвесторов, с которыми мы вели переговоры, либо вели переговоры по участию в проекте ГЧП, это можно отметить канадскую компанию операторов здравоохранения, это InterHealth Canada, с которым мы ведем переговоры с 2016 года, в том числе по участию по проектам не только ГЧП, но и в других инвестиционных проектах в сфере здравоохранения. И это касается не только вложения в активы, но и передачи управленческих навыков, компетенций тех навыков и компетенций, которые наработаны в Канаде. Во-вторых, у нас, в принципе, сейчас институт ГЧП по итогам реализации около 800 проектов уже себя доказал как состоятельный институт, который может защитить права инвесторов. В первую очередь мы сейчас путем изменения бюджетного законодательства, законодательства в области государственного частного партнерства добились того, что, в принципе, то, что просит иностранный инвестор, в основном это прямая гарантия правительства по привлекаемым займам. В принципе, этот вопрос решается всегда очень долго и тяжело, и необходима очень большая политическая подоплека таких проектов. Поэтому сейчас проекты ГЧП конструируются таким образом, что сам договор является, в принципе, квазигосударственной гарантией. Как отметили ранее мои коллеги из Министерства здравоохранения, по многим проектам сейчас можно предоставлять и компенсацию как инвестиционных затрат, так и операционных затрат. При этом средства, которые будут заложены в договорах ГЧП, не подлежат секвестру в процессе исполнения бюджета. Также в законодательстве о государственном частном партнерстве обязательно предусмотрен механизм платы за расторжение. В том числе, кстати, этот механизм очень хорошо себя проявил сейчас во время пандемии, во время форс-мажора, так как по многим проектам у нас идут приостановления. Это касается не только сферы здравоохранения. И, в принципе, этот механизм сейчас рабочий, испробован на практике. Вот. И также есть такие механизмы, как гарантирование части залогов перед банками при привлечении средств внутри Казахстана, тогда как по многим проектам иностранные инвесторы кредитуются в твердой валюте, это в долларах, в евро, поэтому при доказательствах целесообразности проектов мы можем помочь инвесторам, иностранным в том числе, получить кредитные средства в тенге внутри Казахстана. И в этой части мы начинаем помогать и в части обеспечения этих займов. Можно следующий слайд? Как отметил ранее, это компенсация инвестиционных затрат, компенсация операционных затрат и гарантии потребления предоставляется в рамках договоров КЧП. И в целом, учитывая опыт Канады в сфере здравоохранения, он до того уровня дошел, что мы даже когда разговаривали с нашими коллегами в сфере здравоохранения из Южной Кореи, они всегда указывали как первоисточник знаний – это Канаду. Поэтому мы готовы ко всем возможным коллаборациям, ко всем совместным действиям для достижения такой цели, как повышение качества услуг в сфере здравоохранения. Спасибо.
I would like to invite Mr. Damir Kobzhasarov, Director of the National Center for Public Health. Mr. Kobzhasarov will share with us Kazakhstan's response to COVID-19 pandemic. Mr. Kobzhasarov, floor is yours.
Добрый вечер, уважаемые коллеги. Доброе утро, уважаемые коллеги из Канады. Большое спасибо за предоставленное слово. Я хотел бы вкратце рассказать о тех мерах, которые принимает Министерство здравоохранения Казахстан в рамках противодействия коронавирусной инфекции COVID-19. Все мы знаем, что в Китае после начала регистрации инфекции в Китае всеми странами применялись определенные меры реагирования. Это не обошло и Казахстан, так как Казахстан является страной, которая непосредственно граничит с Китаем. После начала регистрации случаев пневмонии в Китае в Казахстане была создана межведомственная комиссия при правительстве Республики Казахстан, куда вошли все заинтересованные министерства и ведомства Казахстана. И данная межведомственная комиссия позволила всем заинтересованным государственным органам принять участие в реагировании. Вся их работа была скоординирована данной межведомственной комиссией. Были приняты соответствующие решения. Казахстан с января текущего года усилил санитарно-карантинный контроль на границе с Китаем. Затем усиление карантинных мер произошло и с другими странами, граничащими с Китаем, а также в отношении всех въезжающих из других стран, в которых эпидемиологическая ситуация по COVID-19 была также неблагополучная. На сегодняшний день в Казахстане зарегистрировано чуть более 120 тысяч случаев подтвержденных случаев COVID. При этом в Казахстане первый случай был зарегистрирован 13 марта. Несмотря на близость и границы с Китаем, получается, что первые случаи в Казахстане произошли через 3 месяца, практически через 3 месяца после регистрации случаев в Китае. И во многом это связано с тем, что были своевременно приняты профилактические меры по недопущению завоза данной инфекции. Но, как мы все знаем, инфекция все равно распространилась в другие страны, не только в Казахстан. И в Казахстане первый случай был зарегистрирован 13 марта. На сегодняшний день в Казахстане умерло от коронавирусной инфекции более 1900 человек. Летальность составила 1,6%. Смертность на 100 тысяч населения 10,4. 10,4. Кроме того, Казахстан ведет статистику вероятных случаев коронавирусной инфекции, то есть случаи, которые не подтверждены ПЦР-тестами. На сегодняшний день таких вероятных случаев у нас зарегистрировано чуть более 40 тысяч. При этом умерло от данной пневмонии, вероятного случая пневмонии, 420 человек. Летальность составила 1,0. Смертность составила 2,2% на 100 тысяч населения. Но вместе с тем стоит отметить, что на сегодняшний день большая часть заболевших коронавирусной инфекцией у нас вылечена. На сегодняшний день более 90% излечены от данного заболевания. Если говорить в абсолютных цифрах, то более 110 тысяч больных уже выписаны из больниц. Также мерами по профилактике ковид является, конечно же, это активное тестирование. На сегодняшний день в Казахстане произведено более 4 миллионов исследований, ПЦР-исследований. Кроме того, проводятся исследования и экспресс-методами тестирования, проводятся исследования методами ФА, поэтому активное выявление больных это является одним из основополагающих принципов противодействия распространения инфекции. Показатель тестирования на 1 миллион населения составил более 210 тысяч исследований. Далее мы в связи с регистрацией случаев коронавирусной инфекции у нас в Казахстане была разработана соответствующая информационная платформа, которая называется «Центр контроля ковид». В данной информационной системе мы ведем полный мониторинг всех заболевших коронавирусной инфекцией. Ведется мониторинг контактных, ведется контакт-трейсинг. Кроме того, нашими учеными, специалистами нашего Центра общественного здравоохранения была разработана система прогнозирования эпидемиологической ситуации в Казахстане, не только в Казахстане, но и в мире. Мы проводим прогнозирование и оценку эпидемиологической ситуации в Казахстане в разрезе регионов Казахстана. Мы ежедневно предоставляем матрицу оценки эпидемиологической ситуации в Министерство здравоохранения, в правительство, в администрацию президента, на основании которой принимаются соответствующие решения по усилению либо смягчению ограничительных мероприятий. В целом в Республике Казахстан на сегодняшний день обеспечена готовность всех органов и организаций, обеспечена готовность системы здравоохранения, всех медицинских организаций, закуплено необходимое оборудование, подготовлен необходимый персонал. Данная работа у нас продолжается. Мы также продолжаем подготовку соответствующих кадров, кадровых ресурсов. Идет укомплектование средствами индивидуальной защиты. Кроме того, в соответствии с рекомендациями Всемирной организации здравоохранения и наших отечественных экспертов были разработаны и утверждены протоколы лечения и ведения больных и всевозможные стандарты противоэпидемических мероприятий, ограничительных мероприятий. В целом мы продолжаем работу по профилактике коронавирусной инфекции у нас в Казахстане. Спасибо за внимание.
Thank you very much, Mr. Kobzhasarov, for very important information sharing with us. And yes, we can notice now that things is improving, and hopefully we'll escape the second wave, which we suffered on the first time, and we'll do the best. And now I would like to invite to the floor Ms. Gulnaz Tanatarova, Director for the Science and Human Resources Department, the Ministry of Healthcare of the Republic of Kazakhstan. She will speak about education and science and healthcare field of Kazakhstan. Please. Ms. Tanatarova, floor is yours.
Добрый день, добрый вечер, уважаемые коллеги, Yerlan Цыганович, коллеги из Канады. Большая честь для нас сегодня представить наши материалы. Как нам интересно, так и вам, наверное, интересно, какова ситуация, куда мы двигаемся, какие проблемы сегодня поднимем именно касательно образования, науки и человеческих ресурсов. Огромное спасибо, модератор. Разрешите начать свое сообщение. Коротко, конечно, очень много материалов, представить это все за такой короткий регламент невозможно, время-период. И поэтому разрешите остановиться на основных моментах. Следующий слайд, пожалуйста. Основные вызовы Казахстана в развитии человеческого капитала страны — это как образование, как профессиональные навыки, как и повышение конкурентоспособности образования. У нас на страновом уровне есть и государственные программы, как и у вас, я вот материалом ознакомилась, у вас тоже есть свои нормативно-правовые акты, законы, да, точно так же и у нас есть такие материалы, где мы строго соблюдаем, выполняем и идем вперед. Но последнее время, следующий слайд, пожалуйста, последний период, у нас колоссальные изменения в системе образования, квалификации медицинского образования и науки произошли. Что же сделано? Что же сделано нами и что мы дальше планируем? Я, конечно, постаралась это все объединить ну, более глобальнее, более, ну, взять только основные моменты. Самое важное, что хотелось бы отметить, что нами сделано было, это, конечно, стратегическое партнерство именно с зарубежными вузами. Вот где мы с вами можем и сотрудничать, да, уважаемые коллеги. Значит, у нас в основных вузах, наших основных вузах определены были стратегические партнеры. Это в рамках стратегического партнерства были привлечены визитирующие профессора с зарубежных вузов, значит, 5 из 5 зарубежных вузов были привлечены провосты, значит, колоссальное количество наших сотрудников, преподавателей, профессорско-преподавательского состава вузов были обучены по циклам топ-менеджеров, значит, для внедрения интегрированных программ образования именно. Значит, повысилась академическая и управленческая самостоятельность вузов. Значит, 5 вузов были реорганизованы именно в НАО. Законодательно они закреплены были формированием университетских интегрированных академических медицинских центров, клиник. Значит, 7 научно-исследовательских институтов, научных центров были интегрированы с вузами, сейчас, которые являются клиническими базами наших вузов. Значит, утверждены концептуальные подходы развития человеческого капитала в здравоохранении. Естественно, был сделан большой свод-анализ, был анализирован международный опыт, и вот это все было концептуально вот заложено в эту концепцию. Присвоен статус исследовательского университета 2 медицинским вузам. 4 медицинских вуза вошли в Лигу академической честности, и независимая оценка, сертификация выпускников у нас проводится центром, которые вошли в международный уровень, и как бы этим мы гордимся. Введены понятия регулирующие нормы, включая порядок клинических исследований, допуск на рынке услуг, применение лекарственных средств, передовой терапии и закреплен статус врача-резидента, которые в клиниках, значит, могут самостоятельно работать как врач. Что планируется? Совершенствование отраслевой системы квалификации. Это разработка отраслевой рамки квалификации, она уже разработана на этапе уже утверждения и профессиональных стандартов, соответственно. Пересмотрена номенклатура медицинских фармспециальностей, внедрены были новые специальности в эту номенклатуру, как ядерная медицина, как неотложная медицина, как, ну и другие, да, кинезотерапии, их не было у нас. Значит, трансформация сертификации медицинских работников, расширение социальных гарантий, защита медицинских работников сейчас на этапе обсуждения и на этапе выхода нормативно-правового акта по защите медицинских работников. И плюс в этом году очень по трудоустройству молодых специалистов очень хорошо помогли и местные исполнительные органы, которые, значит, и предоставляют и жилище, и выплачивают пособия одноразовые. Размер пособия от 70 до 100 увеличилось. Есть регионы, которые сверху одноразовых выплат, они еще выплачивают свои пособия. Поэтому это тоже как бы мотивирует молодых кадров. Значит, внедрение медицинских стандартов подготовки медицинских работников, законодательное закрепление форм взаимодействия медицинских университетов и медицинских организаций, повышение инвестиционной привлекательности именно инновационного сектора здравоохранения. Следующий слайд, пожалуйста. Ну, как бы, если перечислять, конечно, можно...
Well, sorry, yeah, we have we have to be very careful with time because there are many other speakers. And yes, one of the aim of this meeting to establish cooperation between both our countries, and I hope that it will be fruitful for both sides. So, and now I would like to invite Professor Nurlan Dauletbayev, Adjunct Professor, McGill University, Visiting Professor al-Farabi, Kazakh National University. So a couple of words about Professor Dauletbayev. Got his medical degree in Kazakhstan. Following this professional development led him first to Moscow, Russia, then to Frankfurt, Main, Germany, and finally to McGill University in Montreal, Quebec, Canada. He is now Director of Translational Lab at Philips University in Marburg, Germany, Adjunct Professor at McGill University and Professor at al-Farabi, Kazakh National University in Almaty. Professor Dauletbayev carries out research work in translational medicine and teaches the newest scientific methodology to young physicians. And he will be speaking about the knowledge transfer in healthcare, medical education and science experience from McGill and al-Farabi collaboration.
Thank you for invitation to present at this forum. I will highlight the essential developments from collaboration between McGill University and al-Farabi University. On this slide, you see a group of Master of Medicine students from al-Farabi University at Frankfurt Airport. I wish I could tell you that these students were heading to McGill University. This is not feasible yet, so we still have to work towards this goal. For the sake of time, I will skip some of the timeline presented on this slide. What's important is that since March 2019, we have a memorandum of understanding between McGill University and al-Farabi University. And in September 2019, McGill delegation visited al-Farabi University and some clinics in Almaty. Since then, we have been working on several major initiatives, including neurorehabilitation, occupational therapy and physiotherapy, social adaptation, and inclusive education for children with disabilities, and medical English. Here is a photo from McGill delegation visit to one of the rehabilitation centers in Almaty. This activity is very relevant now, given the importance of multidisciplinary rehabilitation in post-COVID-19 patients. Based on this delegation visit and other meetings, we came to several conclusions. Kazakh medical professionals are eager to learn from McGill colleagues, and Canadian colleagues are happy to share their expertise. To start an exchange, this summer we organized McGill al-Farabi video conferences on COVID-19. Evidence-based medicine is the term familiar to Kazakh medical professionals. Yet, especially in rehabilitation, a better knowledge of evidence-based practices is urgently needed. Some medical professionals in Kazakhstan speak good English. The majority, however, would benefit from specialized courses in medical English, such as an interactive online course offered by McGill School of Continuing Studies. Kazakh medical professionals expressed their wishes to improve their skills in presentations, writing medical papers, and preparing consensus documents. McGill University can support this. Many of these points have been addressed by us through the program Physician Scientist at al-Farabi University. The main objective is to improve clinical practice through mastering scientific methodology. Our students are practicing physicians in Almaty. They learn how to conduct critical appraisal of medical knowledge and implement evidence-based clinical practice. Our students learn also of the newest developments, including genomic and transcriptomic studies, computational algorithms, and digital health. Here again, we see that group of Master of Medicine students led by a professor from al-Farabi University during a class, practical class at Marburg University in Germany. After this course, one doctor came back to Marburg for a short internship. She participated in a study that was jointly co-authored by authors from McGill University and al-Farabi University and Philipps University of Marburg. And the results of the study were presented this past October at an international conference. These are exciting developments, but we still have more work to do. Potential further steps towards our goals include a broader collaboration between McGill University with Kazakhstan. We could think of a memorandum of understanding between McGill University and the Ministry of Health of Kazakhstan. It would make sense to create a national program, clinician scientist, to support postgraduate medical education in Kazakhstan and to prepare medical professionals for internships in Canada. Obviously, good medical English skills should be widespread among medical community in Kazakhstan. There are also interesting areas which could be of mutual interest to both countries. These include professional health, occupational health in mining industry, use of artificial intelligence for medical training, digital telemedicine, especially in remote areas, and development of healthcare policies for better balance between primary and specialized care. Thank you again for invitation to speak at this forum, and I will be happy to take questions.
Thank you very much, Professor Dauletbayev. We wish you all luck and to your students, and hopefully they'll get through all this difficult period and will be in McGill University. So now I would like to invite to speak Ms. Slawisky. She is the head of the Canadian Society for International Health. Yeva Slawisky is the Executive Director of the Canadian Society for International Health, where she oversees all operations, including the execution of medium to large-scale projects, supporting the advancement of health and health equity worldwide. Over the past 20 years, Ms. Slawisky has implemented numerous health sector reform projects in Eastern Europe and Central Asia, including Kazakhstan, where the society operated for 5 years. Ms. Slawisky's breadth of expertise and demonstrated through her development and management of projects covering numerous thematic areas within the realm of health system strengthening, including quality improvement and accreditation, evidence-based medicine, health technology assessment, and medical education. Ms. Lewisky, floor is yours.
Thank you, Taskyn. Can I have my slides, please? Thank you. Доброе утро, добрый вечер. It's my pleasure to be here, and it's actually, and also it's my pleasure to see some familiar names in the panelists and in the attendees list. It has been a few years since CSIH has been in Kazakhstan, so many people may not be familiar with who we are. Next slide, please. So the Canadian Society for International Health is a Canadian NGO. We are known within Canada and the global health community for our work in convening the various stakeholders and exchanging knowledge on global health. And a lot of our work, we also do various projects internationally, focused on health system strengthening largely from the capacity building perspective. We're very interested not so much in the infrastructure of the bricks and mortars and the technology, but really in building sustainable health systems and the human resource capacity to make the systems work effectively for the benefits of the population. Next slide, please. So CSIH worked in Kazakhstan from 2010 to 2015, actually a little bit after that as well. And under the first Kazakhstan Health Services Technology Transfer and Institutional Reform Project funded by the World Bank. So our work in that area focused on four main themes or components. Medical education. We were involved in the preliminary stages of that project in providing recommendations on how we can improve the quality of Kazakhstan's undergraduate and continuing medical education to meet international standards. We provided recommendations on improving national accreditation standards so Kazakhstan's universities could meet the standards of the World Federation of Medical Education. And we built management competencies, most recently with direct training of the management and leadership of Karaganda State Medical University and Semyey State Medical University. We did a lot of work at the start to really introduce the principles of evidence-based medicine and problem-based learning into the curricula of the medical education system. While there was, we felt there was a good theoretical knowledge of that in Kazakhstan, we noticed that there was a little bit needed in the hands-on and the practical application, and we were very pleased to support that. We worked on health facility accreditation, working directly with the Ministry of Health to establish an accreditation system which would meet international standards. So under that program, we developed standards, we trained surveyors, we strengthened governance and operation of Kazakhstan's National Accreditation Center. And this we feel led to some improvements in patient care at the pilot sites. And the accreditation center did receive international accreditation from ISQA. We did work with, again, along following the theme of evidence-based medicine and really looking at international best practices. We worked with the Ministry of Health and the Health Development Institute, which I know has been renamed since we've been there. But we've worked with them to develop clinical practice guidelines and trained clinicians to develop, not only to use the guidelines and to know what they're about, but actually to learn about the process of developing the guidelines so that it's not a one-time product, that the capacity would be there to move forward so that there would be more than just the direct products that we left behind. We worked, we know that Kazakhstan has a high burden of disease in relation to chronic disease management, chronic diseases such as stroke, heart and and heart failure and diabetes. And so we worked in a couple of pilot projects in select polyclinics in Petropavlovsk and Pavlodar oblasts to introduce chronic disease management programs. So this again was aimed at looking at the practices within the hospitals and within the polyclinics to really organize the care better so that it's more predictable, more efficient, systematic, and that patients are engaged in their care. So the common theme of all of these projects that we worked on in Kazakhstan is really looking at the development of the human capital, so that we know that Kazakhstan has a lot of resources and has the capacity to take advantage of new technologies and a lot of infrastructure. But what we find, not just in Kazakhstan, but in many countries, including Canada, is that investment needs to be made in human resources and in developing capacities there. So what we've done from the Canadian side, as CSIH was able to mobilize Canadians from across the country, where we have various strengths and in different areas, and bring that expertise to Canada, to Kazakhstan. But we also did it the other way around. We invited many Kazakh professionals to Canada through study tours, where they can actually see firsthand how the Canadian health system works. And so we organized study tours on issues of chronic disease management, around health policy, around e-health and health information systems, and health management and service delivery.
Eva, could you please summarize?
Yeah, next slide. It's going to be super quick now. So the last slide I have is basically to show, just to say that, that the COVID pandemic has really showed how important it is to have really strong health systems in place. You need the surveillance, you need the best practices, you need to be able to analyze evidence. And when we look at Canada as in the map, we can see the cases across the country. Canada has not just one health system, it's a federation, so we have 13 plus health systems. And you can see that there are different responses to the pandemic in in each province and each territory, and often they provide different results in in the burden of disease. So we are happy to. I'm not an expert in COVID, and I know that coming up there is one, and we'd be happy to answer questions more about the various activities that CSIH has undertaken, or some of the resources and expertise that we have been able to mobilize to support addressing the pandemic in Canada and across different countries. Thank you.
Thank you, Eva. Yeah, and now we'll have a real expert on COVID. So I would like to invite Dr. Hafid Soalhin. He's a PhD chief of the National Reference Center for Mycobacteriology, National Microbiology Lab, Public Health Agency of Canada. Dr. Hafid Soalhin is a research manager and the chief of the National Reference Center, and he holds a PhD on molecular mechanisms of drug resistance. He is an associated investigator of the McGill University and adjunct professor at the University of Manitoba. Dr. Hafid's presentation will be focused on COVID-19 assessment, prevention measures, personal and community practices, assessment, and success stories. Dr. Hafid, please.
Thank you, Taskyn. So thank you for the invites. I'm so pleased to be within you and answer your question, and also to share our Canadian experience for COVID-19 response efforts. So I had some question before to answer. So my talk will focus on COVID-19 spread prevention measure that the federal government has established across the Canadian province. So the Public Health Agency of Canada, in collaboration with the provincial or territorial public health authorities, has established and implemented action for reducing spread of COVID-19. So we do this with open consultation with public health experts. So our agency has implemented guidance and awareness resources since the beginning of this pandemic. So the public health measures were adjusted over time. It's a dynamic process. So every measure, it was improved or adjusted depending on the accumulated data or EP data. So, and also the consultation with all partners were engaged and maintained over time. So the prevention measure focus on different parts. So the first one, this prevention measure focus on personal practice, like, for example, physical distancing, how to keep 2 meters apart, how to isolate and quarantine at home when you may have, for example, been exposed to COVID, or you have symptom or without symptom. So wearing non-medical mask or medical mask for healthcare worker. So the hand hygiene and environmental cleaning. So other measure is focused on community-based measure. So that's mean the measure that's applied to business, workplace, or some setting-specific consideration for congregate living setting. So including, for example, the setting with vulnerable population like older population, or some nursing homes, for example. So the workplace, the child and youth setting like school or daycare. So outdoor space, park, community gathering space, restaurants, coffee and spa, and also mass gathering and transportation. So all the setting were make it in consideration, and it was some policies and recommendation given by our agency. To give this recommendation, we are based on the risk assessments. So how to do the risk assessments? So in response to the COVID-19 pandemic, so the Public Health Authority mandated the closure of workplace, outdoor recreational activities, school, and childcare. So with the exception of please providing essential services and goods like laboratory or stores. So even in this place, we support, for example, some teleworking if possible. So we reduce at the maximum the number of employees and personnel inside this place. So a detailed framework has been established to support public health authority in assessing the COVID risk for different settings and identify mitigation measures to recommend when advising on closure or safe reopening during the COVID-19. So this framework guides local public health authority throughout a 3-step process. So the first one is assess the risk level at different type of setting. So we have to assess the space, assess the risk mitigation potential, and also consider next steps for operating with a risk mitigation measure. So this frame is also the risk along 3 dimensions and contains potential mitigation measure as a 4th factor. So we are based on local context, characteristic of individuals, the setting characteristic, and also assessing the risk mitigation potential. So just to recall that this process was every time dynamic. Some measures were modified or some measures were improved, but the very important thing that we keep the communication very open with all the public health stakeholders is very important. So as success stories, I work at the National Microbiology Laboratory. It's the reference laboratory in Canada. It's located in Winnipeg in province of Manitoba. So one success story that we have an emergency operating center that is worldwide famous. We work internationally, for example, with Ebola in West Africa. We work in HIV with different partners. So we have a huge emergency operations center that coordinates supports of response effort like COVID, for example. I can give you a success story for COVID-19 laboratory diagnosis protocol. we were ready before the first case reported in Canada. So when we got the sequencing of the virus from the Chinese partner, so the PCR and the testing was ready. So we have a team that's worked on that. We validate everything. We share the protocol with all the Canadian provinces and territories before our first case in Canada came. So that is very important because we set up a standardized protocol for the whole province in the public sector. And now all the public laboratory, they are reaching out for expertise and quality control. The quality control is very important because you minimize some false results for COVID testing. Another success story, for example, when we have the repatriation flights for bringing Canadian home during the COVID-19 pandemic in the beginning. So this operation center was mobilized and also we repatriate Canadian who were on the Princess Cruise in Japan. So all the repatriates Canadian were group quarantined on special sites and were tested using the National Microbiology Lab mobile laboratory. So it was a good success story because we prevent the transmission from Canadian repatriates from abroad. And also one thing that we have, we think also about First Nation Inuit and Métis in the north. So lately we have implemented some points of care testing for this population because they are remotely and only one case of COVID, it's really hard to spread. So we validate a point of care testing by switching on machines that are, for example, dedicated for tuberculosis, that's called Gen Experts. So we change the process of the machine and apply it to COVID, and it's well done. So it's for other country. An example, that's if you have, I know for Kazakhstan, for example, you have tuberculosis, and if you have Gen Experts machine, so you can deploy it to COVID testing. Is very rapid point of care testing, and it's work very well. So for remote population or community, this testing is very good. To answer the question how our national laboratory can collaborate internationally, so we have very different partners on the 5 continents in Africa, Asia. So, but the National Microbiology Laboratory strategic direction, it's built on reference and surveillance activity. So for established infectious disease. So the disease threats, for example, like hepatitis, tuberculosis, sexually transmitted infection, COVID, we have expertise on Ebola, and we have some teams that are actively deployed in West Africa, for example. So the international collaboration during this COVID pandemic now is not paused, but it's continued remotely during this pandemic, such as protocol and policy sharing. We have technology transfer, and we have also some collaboration on laboratory capacity building. So, and also we have different partners on applied and discovery research on tuberculosis, on hepatitis, and also on COVID. One question that's come out is how the Canadian experience of surveillance with the private lab. So we have a very good relationship between Health Canada, Public Health Agency, and the private lab. So for COVID-19, private labs are supporting research and diagnosis activities. So all diagnosis services that need to be approved by Health Canada, for example, we approve the testing, we approve the new kits, we approve the equipment. So to ensure that we have a high quality standard for COVID testing and other diseases. So in many provinces, like in Quebec or BC, the governments request the private lab support for COVID testing because we have lots. So on the positive case, but if you give some activity to the private sector, you have to be ensured that you have some communication channel between the private and the public. So every positive case of COVID, they are mandatory reports to public health for accurate surveillance and contact tracing. So our lab can collaborate with private sector on research activities, but we always open research agreements and memory of understanding. If we exchange material between private and public sector, but we send some material transfer agreements between the two parties or three parties. So this is just to recall that the National Microbiology is part of the Public Health Agency of Canada. So it's a world-class organization dedicated to the protection of Canadian and global public health. Its mission is to advance human health throughout laboratory leadership, because we are the reference lab in Canada, scientific excellence, and a public health innovation. So several times the NML is mandated to action, for example, for reference surveys, diagnosis, or research, or to bring some expertise on microbiological disease, and also to do some several operation to support the COVID or some outbreak nationally or internationally. So thank you very much again for your invites. I will take any question that you may have.
Thank you very much, Dr. Sohin. So I was about to remind you time. So I would like to invite next speaker, Vera, President of the Iridia Medical. Vera is the President of Iridia, where his passionate focus on delivering unparalleled client experience, building a culture of growth and empowerment, helped Iridia enable peace of mind for its wide-range client base. He has taken a lead role in the development of Iridia's impact mitigation guides for clients that include restaurants, golf courses, fitness centers, production, and catering. Has been instrumental in the establishment of Iridia's COVID-19 testing programs for clients. So the presentation will be on running a healthy business in the face of COVID-19, a Canadian perspective. The floor is yours, Mr. Beckham.
Thank you very much, distinguished guests and colleagues. Really appreciate the opportunity to speak to you today. And KCBC and CERBA, thank you very much for the invitation. Taskyn, Vera, and interpreters, thank you for your support in facilitating, moderating, and making the flow continuous and keeping us speakers on point and on time. Very much appreciated. First of all, I think what's important for me to emphasize is our goal is to support businesses. We have to keep in mind that businesses are not healthcare facilities. They don't have the expertise and the knowledge that many of the colleagues on the call today do. And so some of what I might cover may appear to be very simple in nature, but is a really important thing for businesses to contemplate. So our organization has an experience in supporting organizations through previous pandemics, through H1N1, through H5N1, the outbreak that occurred, of course, in Asia. And we have a very unique role. We sort of do an interplay between public health and business. And as Taskyn mentioned, we've been supporting a cross-section of industries throughout 2020 as they've been struggling with how to operate in a safe environment. And our engagement has been on a lot of different fronts: designing plans, helping them with screening, how they deal with positive case tracing, how they establish a testing protocol for their organization. And what we realized very early on is that there's a need for strategy. Organizations, obviously the goal is to keep going, but they need to do more than that. So we encourage them to look at what the vision is. It's not just to keep going, but it's to provide a safe place for their employees.
Идти вперед, но обеспечить безопасное место для работников, для клиентов, так чтобы сообщество получало большую поддержку от нашей работы.
Important. So throughout the pandemic, things have evolved. Initially, there was some public health guidance, and more protocols and suggestions came forward as the pandemic evolved, but interpreting those is not always easy. Public health orders can be very 50,000-foot level, and sometimes if they require guidance, organizations do to interpret them. And even at when the work focused sector sort of guides are provided, there's still interpretation that needs to be done. And what we encourage businesses to do is to work in lockstep with those guides and consider a phased approach. Right now we're in various states of lockdown around the world, and things can change on a daily. We may get notification that some businesses will be forced to shut down here shortly. So having the ability to be flexible. And so we've created what we call our 5 pillars strategy. It really is not very complicated at all, but is very effective for organizations looking to go forward. And honestly, the groups that have gone forward have looked at it as a bit of an opportunity to demonstrate leadership. So when we start off with safe workplaces and a plan, the very first thing we do is we support organizations in filtering out and trying to identify symptomatic people. And we do this, virtually by having people self-screen at home before they even go to work. We provide them with the tools and education about how that works. Then when they arrive at work, we ask them in their physically distanced work unit to also do another screen. And the point of that is to be able to look each other in the eyes and ensure that in fact people are asymptomatic, and that there's an accountability there, because you really are like a work family bubble, and you need to be able to have that trust and confidence. It's integral to having a safe work environment. And a lot of times what we find is people screen. They use these temperature screening mechanisms. Temperature is okay. It certainly is one of the presenting symptoms of COVID, but it has its drawbacks. It's not generally presented on its own. It's not always the first symptom. And so it can be used, temperature can, but in conjunction with, we argue, a broader strategy for screening people at the workplace. And then, of course, more recently, testing in the hands of organizations has also become an option. And as mentioned by Dr. Hafid, it's important that any positive case that's identified through any mechanism of testing is reported, and there are mechanisms to do that with the private lab that organizations work with. But we filter out the people that have symptoms, and that's fine, but we also know that there are asymptomatic people that never do develop symptoms, and they are a risk to people as well. So what do we do with those? Well, that's when you have your more traditional mitigation measures that you see, like physical distancing, and that's fine. But in the business context with your people, how do you go about doing that? What's the practical implications of that? And you do things like remote learning or remote work, of course, and split shifts and such, and staggered lunches. But at the end of the day, you really have to look at your business through a very different lens, a lens of what are the pitch points? Where are people going to gather? How do I keep them apart? Sometimes if we have modified directional flow through the office, it seems kind of funny, but you have to do that. Maybe you have to close meeting rooms and close board rooms and things of that nature. And then in those scenarios where you can't physical distance and there's an absolute need to be there, think about things like grills inside of a restaurant, for instance, where they've been designed with very close proximity. Under those circumstances, you look at PPE, personal protective equipment, but there's a lot of subtleties to how you choose and which one and how you put it on and how you take it off in a way that doesn't promote the spread of infection. So a lot of subtleties to walk people through and organizations through. Similarly, on the hand washing side, we need to have signage, we need to have triggers, we need to tell people when. We have to remind them that it's 20 seconds, it's duration, it's with soap. Again, in a clinical setting, everybody knows this, but people don't know this as a matter of course in the workplace. You can do dedicated bathrooms for hand washing, just to make that point really, really clear. Enhanced cleaning. Everybody says we need to clean more, and that's true, and it is a potential route of infection, but how does that look? And so what we advocate for is, you again go through your business and you look and you identify these areas, both high touch points, things that a lot of people touch, but also vectors, things that can be moved between people. And what we advocate is you actually identify them. It sounds pretty simple, but put stickers on them. And then you develop a cleaning schedule, and don't just leave it to your cleaners that come in at night. You need to clean during the day. And if you can engage your staff in the process, then they're learning about what to do. They're understanding the importance of doing it, and it makes it resonate with them more so. And one that is really, really simple, again, is just avoid touching the face. It's something that I don't see enough information and signage out there, but it's incredibly important. So if we look through it, the lens of a sick person coming to work and spreading, well, the first level, if we filter them out on the basis of symptoms, they're not coming in. And then once they're in, if we keep them away from everyone else, then that's great for mitigating spread. If the surfaces are clean, that's fantastic. If they're washing their hands, great. And let's say all of that fails. Well, if we're apart from one another, we don't actually stick our hands into our orifices, it mitigates spread that way as well. So these are simple things, but you'd be surprised that, in a very stressful environment, people are forgetting about it. On the pitfall side of things, we see a lot of errors, and it's every business is well-intentioned. They're trying to do their best, working in a space that they don't know very well. They sometimes forget about communications, telling employees about what's happening. We had, over the course of 1 week in June, the symptomology for our province for COVID-19 changed 3 times. It's important that you're on that. It's important that you're able to find a way that you can share it with people without it being a scary thing. Keeping up with the Joneses is just a reference to, you see someone doing something, so you grab it and you throw it into your business. That's fine if you understand what they're doing, but make sure it fits into your overall strategy. Otherwise, it really doesn't work. And in fact, it may be irresponsible, it may be dangerous, and it may be something that the other group was just doing for optics. And on the customer service side, we're not trying to create a hospital. That's not the goal. We're trying to actually support a business running in a safe way. So let's not forget about the fact that you have clients and how they are going to feel about the experience, both that you've done enough, that you've done it in the right way, but also that they can actually, you know, do the business that they're there for. And then PPE, such a topic that's probably worth hours of discussion on its own, but choosing the right type, knowing when to use them, making sure your people know when to use them, and making sure that the business is getting what it needs, but not also taking content and stock that's for the public health that's very much needed. So at the highest level, that's kind of what we've learned over the course of 2020 is what organizations need and how we've been trying to support them. It's a big topic. I've just given a thumbnail sketch, but I hope it added at least a little bit of value. Thank you very much.
Thank you very much, Vern. Yes, very true. We forgot about the simple measures, but what I realized, I think during this time, I've been washing my hands. Like, I don't know, I've never done that much. So, thank you very much. We all have to keep this in mind. And the next, last speaker before the Q&A session, I would like to invite Tanya Chederholm, Director Owner of the Infinity Medical Services. She is the founder and was licensed paramedic before venturing into industrial medical aid. Tanya has a diverse background and has owned and operated 3 over business prior to re-entering the health fields 10 years ago. She is a 3rd-generation emergency services worker and serial entrepreneur with a diverse background running from finance to sales, training, and marketing. So she will be speaking about the practices of her company. Tanya?
Hi, thank you for having me. Oh, my video is not started, sorry. Hi, everyone.
Yes, great to see you finally.
I didn't know how to do it on my own, so I had to wait for you.
So please keep in mind you've got 5 minutes.
Yes, sorry. Vern covered a lot of the topics that I was actually going to touch on today as well. We're both kind of in the same space, which is totally okay. We all service industrial work sites. So some of the challenges that we find in just normal operations of businesses, getting back to work or staying at work, we have to do without power or water. So we've had to be a little bit more creative, coming up with solutions to keep workers on site, isolate sick workers, obviously screen and test people to make sure that we aren't creating our own sort of outbreak within these campsites. So one space that we have moved into, we decided to team up with people after we got through setting up the safe work practices, retraining people on not sharing pens or tools or, you know, maintaining that distance with daily meetings and such like that. We teamed up with a lab to actually do remote on-site testing at workspaces. So we have the personnel that can do the testing. We needed the equipment to be able to test with. So our partner in that space was Caro Labs to begin with, and we basically joined forces for them to be able to provide the testing abilities and us to be able to do the tests. From that, we learned that we didn't necessarily have the best spaces available to do this. So we also teamed up with another company that is providing testing pods, which I actually wish I had shared my screen because I'd like to be able to share with you what these pods look like and the abilities that they have. They are all built specifically for keeping healthcare workers isolated from the people that they are testing. We have HEPA filters windows that are opening for ventilation, water, heat, electricity, all of that stuff. And they are an isolated pod that can be easily picked up and moved either from location to location or transported even around the world. So if anybody would like to see more of that, feel free to contact me after, and I'd love to be able to share those with you. They're just a great space for remote healthcare work in general, and we had to get creative during the pandemic. So I think it's something that we'll see going forward, just period, even once this is over. So thank you very much for having me, and thank you for putting this together. And if you have any questions about the pods, I'm open to questions and answers after.
Thank you very much, Tanya. And yes, now I'm opening the Q&A session. Any questions? I haven't seen so far yet. There was a question referred to Vice Minister, but he already answered. So maybe probably panelists have some questions or comments, please. No questions. Margaret, would you like to maybe comment?
Sure, I can, if I can sum up, and then I will look forward to the Vice Minister also making his comments. The presentations were excellent, and if KCBC's objective was to look at opportunities, I think the panelists from Canada and Kazakhstan gave us those opportunities and that experience. So in just reviewing very quickly, you know, there were projects for competition coming on board in 2021, 2022, including hospital builds. There's more, there's also work to be done on securing more secure foreign investment guarantees. There's also issues that are being worked on, better contact tracing, and we have also education collaboration, capacity building, international certification. We have work and risk assessments, prevention measures, work with government on mitigation measures, and that crosses over between Kazakhstan and Canada, and also with local public health, quality control. Repatriation of Canadians was really important, and that the comment about work with First Nations, Inuit, and Métis, that is also important because everybody has remote communities that need both testing and support. And the congregate living issue also relates to not only seniors' homes and senior situations, but also northern communities. Safe workplaces, safe business places, remote testing in workspaces, the pods, very interesting. So I think that there are many opportunities for not only collaboration, but also discussion. Thank you so much, Vice Minister. Hold on. Is he there?
Vice Minister, maybe you have a few sentences to sum up.
Госпожа Маргарет Скок, уважаемые участники сегодняшнего заседания, хотелось бы отметить очень интересные доклады, очень интересный обмен опытом сегодня произошел. Надеюсь, что данные встречи несут большой вклад в наше дальнейшее укрепление отношений, наше дальнейшее партнерство между нашими странами. Хотелось бы еще раз поблагодарить канадскую сторону за проявленный интерес, а также за возможность обсуждения сегодняшних актуальных вопросов в сотрудничестве между Республикой Казахстан и Канадой. Отдельная благодарность хотелось бы выразить деловому совету Казахстан-Канада за прекрасную организацию сегодняшней встречи. Надеюсь, что наши данные встречи и заседания рабочей группы будут такие же плодотворные и организованы на постоянной основе. Спасибо большое.
Спасибо, очень важно. It's very important, and I think we congratulate the speakers and the commitment as well. As we said, that we were very surprised at the interest, but I think at a very critical time with COVID transmission, when the cases are going up, it is so important to learn from each other. And also, I'm listening to some of the speakers. This is not an isolated, when Hafid was speaking, this is not an isolated pandemic. There could be more. There have been in the past. There are transmissible diseases. So the preparatory work that we do now with our medical practitioners, with our students, with our labs, and with our business practices and our consultants is really important going into the future. Thank you.
Thank you, Margaret. Thank you, Vice Minister. There are several requests are coming to share with the presentation of speakers. So I would like to inform everyone, all participants, that all presentations will be sent out, so you'll be provided. And another important thing, that today's meeting is recording, so you will have a chance to listen and watch it again on CERBA YouTube channel shortly. So, and yes, also to add few maybe sentences to the summary, as this first working group meeting was just a start. We're very hope that it will continue for long, and we'll have coming many fruitful meetings and discussions and cooperation. Thank you very much for the panelists of the first session. And now I would like to open the second session, education part. So, and would like to invite to speak Mr. Yerkebulan Buranbayev, Director of, yes.
So I just wanted to make a comment in advance on the education program.
Yes, please.
Sorry. So I just wanted to say that an estimate by Statistics Canada forecasts that Canadian universities could lose as much as $3.4 billion this year. And this is due to the COVID-19 pandemic. Statistics Canada projected that this loss in large part is due to a decrease in the number of foreign students. There's also an impact as a result of Canadian students, some of whom are not returning back to school after this school year. Tuition fees represent approximately 30% of total school funding in Canada. Canada's emergency response benefit helps some students and their families through these difficult first 8-9 months. But importantly, universities and technical colleges in Canada are adapting, and our speakers from Kazakhstan and Canada will be addressing that. There are certainly, as we have heard in the first section on healthcare and previous working groups, there are crossovers between education, training to our other working groups, and that is important. Thank you so much.
Thank you, Margaret, for the comments. And yes, now I think we can invite Mr. Yerkebulan Buranbayev, Director for International Cooperation of the Ministry of Education and Science of the Republic of Kazakhstan. Mr. Buranbayev.
Thank you. Dear Margaret, Skok, dear colleagues, good morning to Canada and good evening to us. First of all, I would like to introduce myself. My name is Yerkebulan Buranbayev. I am a Director of International Cooperation Department of Ministry of Education and Science. Unfortunately, Mr. Rustem Bigari can't join us, so I'm replacing him. The education system of Republic of Kazakhstan divided into preschool, secondary, technical and professional education, higher education and postgraduate education. Today, cooperation between Kazakhstan and Canada is developing in higher education sphere and science, as well as within the framework of Bolashak International Program. We all know that Canada is considered as one of the best countries to study. Also, Canadian universities ranked among the best universities in the world. Studying in Canada is popular among our citizens. Today, 6 universities of Kazakhstan cooperate with 6 universities of Canada. There are 12 international agreements between Kazakhstan and the Canadian universities. In the period of 2018 and 19, 18 Canadian scientists were involved to 11 Kazakhstan's universities work. There are 37 people are studying at Canada's universities by international program Bolashak. Also, many national universities in Kazakhstan already have close cooperation with Canadian universities. In this case, we wish to continue our cooperation and also develop it with Canada in higher education sphere and science. I would like to emphasize that higher educational institutions and the research organizations of Kazakhstan are interested in cooperation with leading universities of Canada in next 2 areas. First, it's international student mobility and academic exchanges. This will create optimal conditions for academic mobility for teachers and students of Kazakhstani and Canadian universities in various fields. Second is cooperation in the field of research activities by signing of contracts, agreements, and protocols with Canadian universities in the research area. Our aim is to integrate universities as an equal partner in the international scientific and technical space to ensure sustainable links with Canadian universities to achieve an international level of competitiveness of research results. Moreover, today we actively work on opening of foreign universities branches in Kazakhstan. As I mentioned before, Canada has great top-ranked universities, so if they have any practices of opening their branches in other countries, we consider Kazakhstan as well. We are open and can give many options for Canadian universities. So we kindly ask to consider our proposals. Taking this opportunity, we express our respect and looking forward to further fruitful cooperation. Thank you for attention.
Thank you very much, Mr. Buranbayev. And now we would like to invite Ms. Karbozova. She is the president for the Center of International Programs Bolashak. Please, Ms. Karbozova, floor is yours.
Hi, good morning, Canada. Good evening, my Kazakh fellows. Can you hear me well?
Yes.
Well, thank you very much for raising an interest in the Center for International Programs and where is today Bolashak Presidential Scholarship. Just to briefly introduce myself, my name is Aynur, and first of all, Bolashak Presidential Scholarship graduate to join as the new head of the sole administrator of the Bolashak Presidential Scholarship Center for International Programs since last September. So my message I have few messages today, given as Ms. Skok pointed out, those constraints and inconveniences caused by the continuing COVID-19 pandemic in education, cooperation sector in particular. So what we can learn from it and what are the opportunities despite those challenges and inconveniences caused by COVID-19, both within the Bolashak Presidential Scholarship, but in a wider area of educational cooperation. So it is unfortunate that the Center for International Programs is officially associated with only Bolashak Presidential Scholarship, whereas I would like to take this opportunity and make you aware that there are few other directions we are in charge of, which I will make you aware as well. So you know that Bolashak Presidential Scholarship has been established back in 1993 by the first president of the Republic of Kazakhstan, Mr. Nursultan Nazarbayev. And since 1993, in the course of 27 years, more than 13,000 Kazakhstan citizens became the scholarship holders. And as of today, we have around 11,000 program graduates, massively contributing to the different economy sectors development of our country. Somewhere early in 2000, when the economic and social situation in Kazakhstan was much better than in early years of our independence, there was a historical decision made by the first president to raise the number, increase the number of the annual scholarship from the initial 250 to 3,000. And with that purposes, the Center for International Programs was set up with 100% ownership of the government under the umbrella of the Ministry for Education and Science. So the different stages of development we passed through. And as of today, as I mentioned, we do not only administer presidential scholarship Bolashak, but we also are in charge of the intergovernmental scholarships. As of today, we do administer 7 countries. Kazakhstan Ministry of Education and Science did sign bilateral intergovernmental scholarship agreements. So those are Hungary, China, Ukraine, Belarus, Azerbaijan, Turkmenistan, Tajikistan. So these are the parity-based educational scholarships. So just to bring an example, if we consider Hungary, so annually they put forth 250 educational scholarships, and Center for International Programs presents here the admissions and selection committee from the Kazakh side of the examination, and then all the nominants are sent to the Hungarian Ministry of Human Resources, and the final decision is made on scholarship holders. So this is, I would say, in line with what my colleague from the Ministry of Education and Science put forward on the potential area of prospective educational cooperation between Kazakhstan and Canada. It could be potentially intergovernmental projects, not to limit us with Bolashak only. The other prospective area of bilateral cooperation in the field of education, I would also encourage, I would also put forward internationalization of higher education, which we are partly in charge of. So as of today, Center for International Programs did work out the brand book of Kazakhstan higher education, just to make Kazakhstan higher education institutions much more understandable and attractive for foreign students. So the other area our center is in charge of is attracting foreign teachers, attracting foreign students, and attracting foreign universities, in this particular case Canada, to Kazakhstan. So we would really appreciate Canadian universities to take this opportunity and consider Kazakhstan not only as an individual country to develop campus-based representation, but more as a representation in this part of our world, and consider us as a wider hub of representation in immediately neighboring Central Asian and Western China in particular. So internationalization in terms of attracting Canadian teachers to Kazakh universities, Canadian students on academic mobility, parity-based program Yerkebulan, my colleague, did put forward, and also opening representative offices, both individually, let's say, on the territory of the Astana International Financial Center with a relevant tax freeze for a certain period of time, but also under the umbrella of leading Kazakh universities which definitely would be happy to partner with Canadian universities in terms of opening their campuses, both in Kazakhstan and as a wider regional representations. Another perspective area I would emphasize Canadian Education Ministry to thoroughly think over is that Taskyn would probably give more details to our Canadian colleagues on the recent announcement made by the head of the state, Kassym-Jomart Tokayev, as a result of his annual address to the nation of Kazakhstan, where he put forward annual 500 internships to the leading scientists and scholars of Kazakhstan. And potentially this project is going to be administered by our Center for International Programs, and this is something similar to Bolashak Scholarship, but would be conceptually and logistically different to Bolashak. And this would be also another perspective area of our bilateral educational cooperation to explore new opportunities in terms of bilateral scientific cooperation, and also contributing massively to helping having from mid to short to longer term up to 1 year internship programs with this prospective project, which is expected to be launched from early next year. So I will not,
could you please summarize? We're out of time.
Well, yeah, I will not be going into details with all these statistics, just to say that as of today, I started my presentations with general statistics within the Bolashak Presidential Scholarship, and I clarified that in the course of 27 years, 13,978 Kazakh citizens became Bolashak Presidential Scholarship holders, and only 254 of that number belong to Canada. So given the Canadian university's potential, I think it's quite a low number to share, and that's unfortunate and disappointing, I think, number. So what we can do, given the information I provided, is, and also those challenges and inconveniences caused by COVID-19 in mind, we could talk to the Canadian universities and explain the way Bolashak works, and to make just to make them understand how to make Canadian universities as attractive as possible to the prospective Bolashak recipients, and even in terms of number of universities from Canada represented in the list of the universities for Bolashak scholarship holders 2020. As you can see, this year all the areas of Bolashak Presidential Scholarship were quite harshly tightened in terms of requirements, both for the applicants, but also to the universities. Just a quick statistical example is that last year, for example, we had 537 universities included, but this year it's 3.5 times shorter, but quality-wise, we use these 4 major academic ranking league tables to quality-wise shorten the list. So in the list of 2020, there are 138 universities, and only 6 of them belong to Canada, as you can see listed at this slide. So I will not go to this Bolashak, you know, all these areas. So the quick message is that the Center for International Programs, as the educational partner from Kazakhstan to any of the Canadian universities, just to say, is not only a sole administrator of the Bolashak Presidential Scholarship, but also we administer intergovernmental scholarship programs. We administer internationalization of higher education, but also we are potentially going to operate 500 internships program for Kazakhstan scientists and scholars from early next year. So I do invite all our Canadian educational partners to explore this opportunity and to massively partner with us. We just look forward to explore all those upcoming opportunities. Thank you very much for this opportunity. Thank you.
Yes, thank you very much. I'm sure there are many universities and colleges listening and watching, Canadian colleges listening and watching us today, and there'll be lots of requests for further cooperation. So, and now I would like to invite next speaker, Dr. Loretta O'Donnell, Vice Provost for Academic Affairs of Nazarbayev University. Dr. Loretta was appointed in 2013 as a Vice Provost at this university. She coordinates with deans to develop international quality academic systems for educational programs and liaises with Nazarbayev University strategic partners, including Duke, National University of Singapore, and University of Wisconsin-Madison, to implement the academic mission of the university and share new experiences with local and regional universities. She has over 20 years of experience in teaching executive MBA, postgraduate and undergraduate business students in UNSW Business School, University of New South Wales, located in Sydney, Australia. Dr. O'Donnell, please.
Thank you very much. Spasiba Rahmet. Thank you. Good morning, good evening, everybody. My name is Loretta, and I'll just take 5 minutes or so to introduce you to Nazarbayev University, which is a flagship university of Kazakhstan located in the capital city of Nur-Sultan, an English medium university. And we're interested in working very closely with our friends in Canada in programs, in research, in anything that might be of interest and mutual benefit. So we are very proud of our Kazakh culture, and we are very grounded in the Eurasian area. That's our distinguished colleague Gulnaz Kurumbay, the director of our cultural center and the dean of the School of Sciences and Humanities. That particular school runs a very well regarded Eurasian studies program, which is now starting to win very competitive awards around the world that may be of interest to some Canadian citizens. We are clearly at the center of Eurasia, and our Eurasian studies program is very well grounded in the region. We have some 6,250 students, mostly from Kazakhstan, about 100 students from international countries, I think 20 different countries. I think none of them are from Canada at this stage, but we would certainly welcome students. Our PhD programs in particular are gaining a lot of popularity in mining and geosciences, but also in medicine, in biology, in public health, obviously due to the conditions in which we operate. Our undergraduates have moved into some very strong graduate programs on full scholarships by host universities. Our graduates are now studying on full scholarships at Harvard, at Oxford, at Cambridge, at MIT and Stanford, in everything from computer science to biology. So we do tend to attract the best students in Kazakhstan, and we have 550 professors from around the world. I think we now come from 59 different countries, and at least 12 of our professors are Canadian citizens. The Associate Provost for Graduate Study is a Canadian. He's from originally from Newfoundland, but he's now from New Brunswick, and our new HR director is actually from Nova Scotia, and she's never visited Kazakhstan. She's working from home at the moment, but supporting us beautifully from her Canadian home. But we would like to explore opportunities with you. My email address is on this slide, and we are a full research university. We do both fundamental and applied research. We're interested in working with you in terms of faculty collaboration, student projects, and that includes student internships. We are very interested in exploring virtual internships, if that's of any interest to you or your colleagues. We're very strong and conscious of our capability in developing intellectual human and knowledge capital. This is a photograph of one of our 120 student clubs. This is the Society of Petroleum Engineers. There's 600 student members. It's one of the most popular clubs on campus. Our students, even at the undergraduate level, are very interested in research, and they do collaborate with their own professors and professors from around the world. These are some of our engineering students who their research posters are working on everything from air quality to mining to geology to public health and molecular medicine. In terms of, so there's many opportunities. In terms of challenges, we are fairly young. We're only 10 years old as a university. So sometimes the innovation which we're engaged in means new procedures, and that might take a little bit of time, but we are very committed to working with industry in Canada, to working with other Canadian universities, to working with a range of enterprises. And there are many ways to explore mutual benefits. As some of our colleagues have mentioned earlier, the issues of integrity are very, very much part of our DNA. All of our graduates take integrity very seriously. It's something that's very close to our heart, both in all our academic programs and certainly in our research. And our research is benchmarked at international levels. Our field-weighted citation index is now 1.5, so our colleagues are being represented in top journals and top publications all over the world. So there are many opportunities. We just need our imagination to explore those opportunities. The challenges might be it takes a little bit of time to articulate the right procedures, but the next steps, please contact me if you're interested in anything that we're doing at Nazarbayev University. You can see Kazakhstan as a nation is open to new ideas, open to talent, open to working with the top people in the world. We're obviously on the web, we're on Twitter, Instagram, and all social media. So I look forward to hearing from you. Thank you very much.
Thank you very much, Dr. Loretta. Now I would like to invite Ms. Jennifer Dobny, Executive Director of the International Education Division, Global Affairs Canada. Jennifer Dobny has served as Executive Director for International Education at Global Affairs Canada since September 2018. Prior to assuming this position, she was Canada's Consul General in Bangalore, India from 2016 till 2018. She has also been posted abroad in London, Guadalajara, and Prague. At headquarters, Jennifer has served as Executive Director of Global Affairs Canada, Science, Technology and Innovation Division, as Director for Investor Services, and as Director for Commercial Relations with the Middle East and Africa. She also worked on a range of trade policy and bilateral relations issues over the course of her career. Ms. Dobny, the floor is yours.
Good morning, everybody. Is the audio okay?
Yes.
Perfect. Okay. Good morning to the Canadians, and good evening to those of you in Kazakhstan. As Taskyn just mentioned, I'm the Executive Director of the International Education Division at Global Affairs Canada. And today I'd like to speak a little bit about the education sector in Canada. I will touch briefly on the impacts of COVID-19 on the sector, as well as the education solutions and know-how that Canada has to offer. And I'd also like to offer some examples of recent engagement between Canada and Kazakhstan in terms of education bilateral relations. And I will also mention the kind of support that Canadian Trade Commissioner Service can provide in terms of business support, partnership support, and how we look forward to working with your organization. So in Canada, education falls within, under our constitution, it actually falls to the provinces and territories. So it's provincially and territorially mandated. For us at Global Affairs Canada, our foreign ministry, our role falls into three broad categories. We are responsible for bilateral and multilateral education policy and management of federal, provincial, territorial coordination. We also support, through our development ministry, education-related development initiatives. And finally, we work to promote the education as a priority service export sector. And this is the area where my division, my group, is most actively engaged, including with countries like Kazakhstan. And this, when I say we're promoting exports, we're essentially promoting exports of education services. So goods and services related to education, but also recruitment of foreign students to come study in Canada. So moving on, you'll see there some pretty big numbers. Education is a really important sector in Canada. We have, at the end of 2019, in December 31st, we had almost 650,000 students, international students in Canada at that time. But we actually get many more during the year. The number who had been here during the year was about almost 200,000 higher, because not all of them, of course, stay. Some come for shorter periods. But it's a lot of international students in Canada. We're well known for the high quality of our education system, including our research, innovation, and you know, I think our student-centered approach. Some of the other areas that we're focused on, you'll see a number there, 23.5 billion Canadian in exports of educational services. Some of that, it represents incoming students, incoming international students. So that's clearly important. We also are very active in sale and licensing of Canadian curriculum, sale of training, both for corporations and others. And one of the other things that we have do very well is we actually have a number of organizations, associations, and institutes that are actually involved in basically selling their services to help support the development of education sectors. So one of those areas where we have an organization called CICAN, Colleges and Institutes Canada. They have worked in many countries around the world, basically working with countries to help them set up a TVET sector, an effective TVET sector. So there's a lot going on with Canada's international education sector. So it's an important one for us, and one that we place a lot of priority on. Moving on. COVID-19, it's impacted us all, and not in good ways. Canada remains very committed to the international education strategy that we announced almost a year and a half ago. We're trying to move forward on the goals and objectives of the strategy, regardless of the COVID pandemic. Through the strategy, our government committed $148 million over 5 years to support the sector. Some of that is for marketing and diversification. We are actively trying to recruit a broader range of students from a broader range of countries to study in more destinations in Canada. So we're keen to see more students coming into Canada from, for example, Kazakhstan. And one of the other areas that's interesting under our new strategy is we put, the government allocated money for two-way mobility. And in fact, a big pot of money to try to get Canadian students to study abroad, and when they, to study or work abroad. And when they study or work abroad, we're very interested in seeing them going to maybe some of the non-traditional countries. When I say traditional countries for Canada, our students love to go to the UK, they love to go to Australia and New Zealand, they love to go to France. But fewer of them are interested in going to Peru or Kazakhstan or you name it. So we're really trying to broaden their, broaden the opportunities for them. Now this is has been, as you can imagine, some of the elements of our international education strategy, particularly around outbound mobility, are on hold at the moment in terms of actual mobility because of the COVID situation. But we are seeing our institutions and our programming, we're seeing some very interesting, innovative approaches, virtual mobility, COIL. So there are still things happening and still opportunities for mobility, even if it's not at this point in time physical mobility. looking at COVID-19, we certainly highly value the international students who have chosen to study in Canada. And student well-being is incredibly important to us. The current situation, we all know it's very, very challenging, but we are in this together, and we will get through it together. We did put in place a number of programs to support students through the COVID period. Many of these programs, or a number of them, were also available to international students. And we are also working actively now to try to facilitate the safe and orderly return of international students to Canada. For about 6 months, there were virtually no new international students coming into Canada because of border measures. We still have border measures in place, but we have now produced some, or we have made some amendments that does allow for some international students to come into Canada. So they are slowly coming back to Canada, and we're really thrilled to welcome them back. The other thing I'll mention is our Immigration, Refugees and Citizenship Department did put in place a number of measures and flexibilities to help accommodate international students during the pandemic period. Some of these have to do with work permit options, others have to do with applications for study permits in Canada. But we are trying to be as accommodating as we can in what we know is a very, very difficult time for everybody. So for anybody who knows students who are interested in Canada, if your institution is looking at potential mobility programs, particularly for those students who are looking to go to Canada, I advise them to look at the websites very carefully. The information does change quite frequently. And for others, institutions, if you are interested in partnerships, we'll talk at the end a little bit about some of the best ways forward on that and some of the resources available to help you. Next slide is I'll talk just a little bit about what our Canadian Education Export Services involve. In some instances, these are research and technological solutions to address challenges. Of course, we've got sales of education services, technical training, management courses, professional training, export of Canadian curriculum and know-how to support capacity and skills development. And then Canada has a lot of expertise in English and French language programs. We are an officially bilingual country, and that means that the teaching of both official languages is kind of hardwired into our school systems at all levels. And we have a very active language training sector. So there's some good opportunities there. Just looking specifically at Canada, Kazakhstan, we've seen an increased interest from students in Kazakhstan. Since 2015, our numbers have gone up 37% in terms of the number of students who are here. 2019, December 31st, just under 1,200 Kazakh students here. I would imagine those numbers, we don't have our full numbers for this year. I would imagine those numbers are lower this year. They're lower for every country. It's just the reality with COVID that it's been difficult for students to come into Canada, and some have chosen not to travel, and others are pursuing online studies. And that said, we have ongoing engagement with Kazakhstan. We have, I think all of you on the line will know probably better than me, but some really strong compatibilities in agriculture, oil and gas, mining. Those are areas that there's a lot of synergies and opportunities for collaboration. We have engagement on technical and vocational education training. There are some joint degree programs being offered. I mentioned Canada's strengths in English and French language training, and that's certainly of interest to Kazakhstani students and institutions. We have been doing, and then our institutions continue to be interested in establishing partnerships. We have also been doing virtual fairs around the world, and including a Central Europe and Central Asia fair that took place earlier this month.
Jennifer, could you please summarize?
Yes.
We're out of time.
Absolutely. I think I am on my last slide. So I just wanted to mention that we have a trade commissioner service that works globally, and we have Nathan License. I think Nathan's on the line today. He's probably been on all morning. So he's based in Nur-Sultan and been there a few years now, so knows the market well and knows the opportunities well. So he can support you in gathering business and competitor intelligence on the local education market. If you're a Canadian institution, if you're from the Kazakh side, he can help to identify potential good matches with Canadian partners. He's very keen to communicate opportunities to clients, support the development of strategic alliances and partnerships, and really just to speak with you on the range of opportunities, be it strategic alliances, be it licensing, R&D collaboration, tech transfer, or possible cross-sectoral opportunities. So please do not hesitate to reach out to him. His email is on there. And as I say, I think a number of you on the call probably know Nathan quite well. So I'm open for any questions if time allows. And thank you very much for the opportunity to present.
Thank you very much, Jennifer. Yes, I know that most of students who choose to study abroad suffering at the moment because all visa centers closed and Canadians just opening. So, but at the same time, it was interesting to learn that Canada is looking forward to cooperate with Kazakhstan, and Canadian students are very welcome to Kazakhstan. And I think there will be a lot to communicate and cooperate with our ministry and institutions. Thank you, Jennifer. And now I would like to invite Dr. Randall Martin. We have today very wide representation of governments from both sides, and Martin represents British Columbia Council for International Education. Dr. Randall Martin has experience spanning 30 years in post-secondary education, development education, project management and implementation, and international education, having worked on projects in institutions, in societies, and most recently leading the CECIE, a crown corporation of the province of British Columbia, charged with advancing the provincial agenda of international education. He has authored and co-authored numerous papers, is a regular presenter at national and international conferences and symposia, and regularly engages in external reviews and consultations for institutions and other jurisdictions. Dr. Martin?
Thank you very much. Appreciate this. It's just getting light here in Vancouver. Good morning to all of you. Good evening, afternoon to some of you. Thank you to our hosts. Thank you, Taskyn, doing a fabulous job of moderating this morning. Our co-chairs and our representatives from government in Kazakhstan, and Jennifer, of course, here in Canada. Also like to thank you for this opportunity to wear a tie today, the second time since March, I think. So it's very exciting. So hello from Vancouver, British Columbia. I am the Executive Director of the British Columbia Council for International Education. Thanks for allowing me to join you today to provide this overview of the work my organization does in international education, and to discuss a little bit about BC's education system and opportunities for collaboration between Kazakhstan and BC. As Taskyn mentioned, BCCIE is what we call a crown corporation, or an agency that is funded entirely by the government, in this case, the government of British Columbia, in order to execute the government's agenda in a certain area. We are not government, but very close. And again, education is a provincial responsibility in Canada, not a federal responsibility. But of course, we have great oversight and support from the federal government in a lot of our activities, especially international. We provide expertise on all aspects of international education, including partnerships and mobility. And we would be very happy to act as an intermediary, as a matchmaker for institutions and scholarship programs from Kazakhstan to British Columbia. And if we don't have my email address up here yet, I'll make sure I put it in the chat line, or I'm sure Taskyn can provide it to you afterwards. We're also involved in new market entry, mature market maintenance, recruitment and enrollment management, both inbound and outbound student mobility, capacity building, and sort of a big tent approach to international education from kindergarten to PhD, public, private. So we sort of cover the waterfront in British Columbia to coordinate this sector. We work closely with both national and provincial authorities. That was my son getting ready for school, walking behind me here. These jurisdictions, both federally and provincially, are very aware, and perhaps more so now due to COVID, of what international education practitioners and leaders have known for some time: the importance of international education as a driver of our economy, immigration, labor market development, innovation, and the broader education sector. International education is a hugely important part of BC's education ecosystem in terms of diversifying our classrooms, offering intercultural experience, opportunity and growth to our own students, and inviting students from around the world, like those from Kazakhstan, into our own communities. And I know that a number of our institutions have been active recruiting students from Kazakhstan. In fact, my wife is responsible for one of our K-12 school districts, and she was just in Kazakhstan last year attending some fairs. And she loved it, and my son actually has a Kazakhstan t-shirt that he wears all the time coming from that trip. BC's education system is considered quite strong and one of the best in the world. At the K-12 level, our public system has 60 school districts, more than 1,600 public schools, about 370 independent schools, and smaller than average class sizes. Our Ministry of Education for K-12 sets policy, establishes a curriculum and assessment, and certifies and regulates BC offshore schools. At the post-secondary level, we have 25 public post-secondary institutions, including universities, colleges, and institutes in British Columbia, and over 300 private career and vocational colleges and degree-granting institutions. One aspect of BC's education system is a world-acclaimed transfer credit system, which means that students can move easily from one qualification level to another, and from one post-secondary institution to another. It gives students a great flexibility to choose a study path that best suits their educational goals. Our Ministry of Advanced Education and Skills Training, to which we report as BCCIE, provides leadership and direction for post-secondary education and skills training in BC, as well as labor market information and programs. We work very closely with the ministry to deliver on government priorities for international education. There are a few organizations which I think are of note in terms of coordinating our BC post-secondary system. One is BC Colleges, that works with an association that works with 11 community colleges in the province. One is the Association of Institutes and Universities, teaching universities and institutes. Together, they account for about 40% of the students attending public post-secondary. And finally, the Research University Council of British Columbia, representing the interests of BC's 6 research universities. They are also a good entry point into discussions of joint research, of collaboration, partnership, etc. And again, I could make introductions there if appropriate. We have great regional representation of our research universities across the province, but we have only one medical school at the University of British Columbia, which was on a slide earlier. It's a very fine medical school. Unfortunately, it does not accept international students. We have a need for one more medical school in British Columbia. And in fact, we just had a provincial election last month. And one of the promises of the incoming government is to build a new medical school at one of Canada's top comprehensive universities, Simon Fraser University. They have a number of campuses, one of which is in a city called Surrey, which is adjacent to Vancouver, which is one of the fastest growing cities in Canada. And this school will be a welcome addition to BC. And this school it plans to offer admission to international students as well. COVID-19 has been discussed. Our education system from K-12 and post-secondary have taken close to a $2 billion hit just in tuition revenues in British Columbia. So obviously this is, the government is very, very interested in supporting recovery, looking at models to sort of get more international students here, and as Jennifer mentioned, to get more of our students out on the road and in countries that we work and trade with. COVID has given us more scope than ever for collaboration, and of course everyone has had to pivot or transition to online and hybrid instruction, which is in fact, there's a silver lining to all of these issues. It's created a lot of innovation. It's created more access for more people, and I think raised the issue of diversity, equity, and inclusion in international education. Some things we don't believe will ever return exactly to the way they were before, and some things will feel like we never left them when we return to our schools, hopefully within a year or so when things start returning to normal. As Jennifer mentioned, over the last recent years, we've seen a steady growth in study permits of students coming from Kazakhstan, with close to 1,200 students studying in Canada at the end of last year. There is an untapped opportunity, I believe, between BC and Kazakhstan, in addition to student recruitment and partnerships. One of these areas is in BC's offshore school program, and I'll just take a few seconds to talk about this. The Ministry of Education, I think we have about 48 BC curriculum schools teaching in other countries, either standing solely to offer the BC curriculum or in partnership with domestic curriculum or other international schools. The students who graduate from these BC offshore schools have easy access, and once they graduate, to universities around the world, but certainly into universities in British Columbia and Canada. And I know our province is looking to ambitiously grow the number of BC offshore schools globally. So if you're interested in any, or if you know of schools that would like to partner, or philanthropists which would like to support the growth of a BC school, I would be very happy to engage there as well. These are just a couple of preliminary ideas. We look forward to being able to return in person to Kazakhstan for partnerships and student recruitment. But the fairs that Jennifer's organization are putting together, our Study in Canada fairs, are very, very helpful. Even the virtual fairs to help raise the profile of the quality and the opportunities in Canada. So I'm sorry if I spoke a little bit quickly. I didn't want to get the bell rung on me, and appreciate the opportunity to speak today. And again, thank you to Taskyn and your colleagues for putting this session together today. Appreciate it.
Thank you very much, Dr. Martin. Yes, I'm sure there are many things to work and cooperate, and I hope that it will continue for long, and we'll work on it. So, and the last speaker, I would like to invite Professor Teddy Sami, Director of the Norman Patterson School of International Affairs, Carleton University. Teddy Sami is a professor at this school, and his most recent book is Exiting the Fragility Trap, Rethinking Our Approach to the World's Most Fragile States, co-authored with David Carman and published by Ohio University Press in 2019. His current research interests include state fragility, aid effectiveness, domestic resource mobilization, and income inequality. Professor Sami, please, floor is yours.
Okay, thank you, Taskyn. I've shared my screen. I assume you can see it, right? The presentation?
Yes.
Okay, wonderful. Thanks everyone for organizing this meeting. Thanks for the invitation to you, Taskyn, and your team. I will spend very few minutes just talking a little bit about the university where I teach. I've been at Carleton for 17 years now. I think it's a good ending to this session because we started with somebody speaking about the federal approach and then the provincial approach, and I'm going to talk about something even more micro, where I will refer to a particular university and in fact a particular program within the university. So just by way of background, I think this slide speaks for itself, just to give you a sense of, what the university looks like. Carleton is what I would call, sort of a mid-size university, perhaps a little bit bigger than mid-size. It has over 30,000 students now. Mostly undergrads, but we do have quite a few graduate students as well. It's a university that has been around for over 75 years, more than 150,000 alumni worldwide. And, we're getting close to about 5,000 international students. So there were 4,575 international students in the previous academic year before COVID-19. So, you know, it's a university that has grown significantly since I've been with that institution. It has brought in more and more research income through various partnerships, including funding from the federal government. And one of the key things about the university is the location in Ottawa's capital, which connects us to the policy community, but also to the rest of the world because of where we are. So it's not surprising that when international students are often looking for a place to study in Canada, they will tend to gravitate to the bigger cities like Toronto, Montreal, Vancouver, but they also look at the capital, which is Ottawa. Of course, as some of you may know, there's another university in Ottawa, which is the University of Ottawa. And I think these two institutions tend to complement each other quite well in terms of what they offer. So for example, we don't have a medical program, a law program, but that's available at the University of Ottawa. At Carleton, we welcome a lot of visiting scholars every year from all over the world. We have a lot of international research and student exchange agreements with various partners around the world. So I'm going to switch to, let me see if I can move this slide. Sorry. Okay, previous one, please. Oh, there we go. So I talked about the university already and its location. You know, again, I can't emphasize enough the fact that we are located in the federal capital. Many of our students take advantage of opportunities with the federal government in particular, but we also have a strong reputation for excellence in a number of programs, in particular the school where I've been teaching, and I'll talk about this a little bit towards the end. We also have very strong programs in public administration, in engineering and science, in physics in particular, and then also architecture and business. One that is missing on this slide is we have a very good school of journalism as well at the university. Just sorry, there's a bit of a delay in terms of my slide is not moving very well. Okay, there we go. So I've talked a bit about some of the flagship programs at the university. There's a new Bachelor of Global and International Studies program that was recently created. There's a Bachelor in International Business. So these are programs that have an international profile because students have to do some of their work, some of their studies abroad. So they go on exchange for a specific time. And then there's the school where I've been teaching, which is the Norman Paterson School of International Affairs, which is different from the previous two because it's a graduate-only program. So we offer MA and PhD programs, and I will come back to this in a few minutes. In terms of visiting scholars and researchers, as I've mentioned before, there's a few of them, there's quite a few of them that visit the university every year. At the school where I teach, for example, we welcome visiting researchers every year. We have an arrangement with Fulbright Canada, for instance, where we bring scholars from the US, but we're also open to welcoming researchers from other countries if there's a fit with what we do. So what I would encourage people to do is to take a look at the website and see whether there's opportunities for them to collaborate. And if that's the case, then we can provide the physical space and equipment that people need for a year. And typically, when people when they come in, they are funded by their own agencies, or they have external funding to support them during that time. So, other units on campus have similar arrangements. There are a number of visiting scholars that come under specific programs. For example, there's one on the slide that you can see, which is funded by the Government of Canada. And that was for visiting scholars coming from Chile through something known as the Emerging Leaders of the Americas program. And of course, these visiting appointees contribute in a number of ways. And so they add to the research profile of the university. And they are also very beneficial for our students as well, if they can learn from international scholars. So a key contact point for people who are interested in partnerships and MOUs with the university is Carleton International. So this is the university's international office. They will help facilitate any sort of agreement or MOU that other universities in Kazakhstan might be interested in. They also manage a number of other entities on campus, which are listed here. I won't go into too much detail about this, but the only thing I would say is that they should be the main contact point. And so if people are interested in establishing at least the preliminary steps to get into partnerships and MOUs and learn more about exchanges, those kinds of things, I'd be more than happy to provide you with their contact emails and people in that office to assist you.
Thank you very much.
Yeah, and just one final thing is the school itself. Again, a lot of what we do is already on our website, so I encourage people to actually take a look at what we do. The last thing I would say, I mean, a lot has already been said about the impact of COVID-19, so I won't go into too much detail about this, but it is a challenging environment, I think, for everyone. It's still too early to know what the long-term implications will be for students or the numbers and so on, but I can tell that from this year at least we haven't noticed a significant impact in terms of enrollment. So we still have very healthy enrollment in the school. I think the bigger question is how long this will go on and how sustainable it is. Obviously we're all waiting for a resolution to this pandemic, so hopefully, I mean, at least for me personally, the hope is that we'll be back on campus next September, but nothing is guaranteed yet. So I will stop here and happy to take questions if people have them about the school or other programs at Carleton. Thank you.
Thank you very much, Professor Sami. Now it is very late in Kazakhstan and we're almost out of time, and we will take very short Q&A session. And there is one question referred to Jennifer. So there is a question about studying Canada scholarship next year. What is going to happen? Jennifer, if you could answer, please.
Hi. Yes, we were very happy to be able to offer a study in Canada scholarships. It was the first year of a new scholarship program, and Kazakhstan was one of the eligible countries for the first cohort. We have not yet announced the second cohort, but I can confirm that it will be a different set of countries in the second cohort. Unfortunately not Kazakhstan this time round.
Okay, thank you very much, and I hope we'll get it maybe the other next year. Dear ladies and gentlemen, I would like to invite this working group co-chairs to make conclusions for their final remarks. Please, Margaret, Vice Minister Kiyasov.
Thank you very much. I will be brief. I think it's really important. Everybody spoke about opportunities, and Mr. Buranbayev noted that there are 12 international agreements between Canadian and Kazakh universities. This is excellent. In terms of Bolshak, I remember years ago we started off with 27 students, and now I think 800 of the 1,200 students are Bolshak. In terms of Dr. O'Donnell, the fact that that there's interest in working with Canadian universities, research and Eurasian studies. We have a complementary program faculty at Carleton, and it's great that you are open. We are looking for opportunities for both our students and for our profs. It's really important. Jennifer, Dovny, thank you so much. The programs with respect of immigration and refugee to facilitate the work and study permits is going to be critical during this period. Dr. Randall Martin, that was very excellent. K-12 and BC's offshore school program. What an opportunity, and that's something that can be explored with Kazakhstan. And Professor Sami, thank you so much for exploring all of the programs, faculties that we have at Carleton. So there is an opening, and these branch campuses, we look forward to hearing more. Thank you so much for all of this very concrete opportunity and description.
Thank you, Margaret. Vice Minister.
Господин Buranbayev там или нет?
Yes, as well.
Я думаю, что я выражу общее мнение наших сегодняшних участников рабочего совещания. Встреча прошла очень продуктивно, обменялись мнениями, информациями. Хочется верить, что сегодняшняя встреча пойдет на пользу, будет хорошим стимулом для развития дальнейших отношений. Большое спасибо. Еще раз повторюсь, большое спасибо организаторам сегодняшней встречи. Я думаю, был очень полезный обмен информацией. И во второй части видите, что есть у нас поле для развития дальнейших отношений. Есть уже проекты существующие, необходимо их дальше развивать. Большое спасибо, желаю вам всем здоровья, удачи, до новых встреч.
Thank you very much, Vice Minister. Mr. Buranbayev, would you like to add your comments?
Спасибо за организацию, спасибо, мисс Маргарет Скок. Сегодняшняя встреча была очень полезной для нас. Мы получили много информации об образовании Канады. Спасибо за все ваши презентации. Мы все это еще раз пересмотрим и в дальнейшем будем пользоваться для развития нашего сотрудничества. Также презентации в сфере здравоохранения также были очень интересными. Я думаю, эта встреча принесет нам очень много пользы, и в дальнейшем мы продолжим наше сотрудничество в сфере здравоохранения и образования. Вам, коллега Дженнифер Добини, вам также очень большое, огромное спасибо.
Thank you, Mr. Buranbayev. To finalize, I would like to thank all panelists for their enormous contribution, for interesting presentations, and for the participants as well, staying that late and keeping interest in our working group. So one thing to maybe remind, as I've said earlier, next week on the November 25th and November 26th, we will have plenary sessions, 2 days. Please don't forget to join. There will be a summary of all working groups, and on the 26th of November, we'll have a ministerial session from both sides, Government of Canada and Kazakhstan, making conclusions and further plans for cooperation. And as we learned today, there are a lot to do. There are many opportunities, and we're all open, both countries. And as the regional director of CERBA-Kazakhstan, I'm always happy to help you, to support you, and looking forward for cooperation. Thank you very much, and have a good day, and sleep well and stay healthy.